The Community Deal is very much a key ambition within the Frimley Integrated Care System strategy. It's very much an enabler. The individual people in individual communities have a much better understanding of what works for them and their communities than probably we do as organisations.
This ongoing dialogue between ourselves and those we serve, and you have to give help and support to people in a way that they feel they can access, that they can use. We don't have all the answers, and very often our communities do.
We're standing on the site of what will be our new community garden in Fleet. I think people have had a lot of restrictions placed on them in the last 18 months, lost control over their lives a bit, and I think this is going to really build people's resilience back up and keep them fit and healthy and happy and make new friends.
We're really bringing together a whole variety of people from across our district where they can share their experiences, they can socialise, they really get an opportunity to get out, and that's so important for community spirit, health and wellbeing, socialising. It's really important to us that we create a place that people value and love and want to come out and use.
In my role, our main aim is to build partnerships to ensure that places like the Hart Green Garden can be established. It requires a lot of partnership working, collaborative working, and I'm delighted to see that that collaborative working has brought together everybody, and in the next couple of months we'll be able to start bringing it to life.
Working alongside Men's Shed particularly, they have been so supportive. They've built us some really great things for the site, saved us lots of money.
It was just natural, just felt right that when they told us about the community garden, was there anything we could do to help, that we said yes, of course.
At the end of the day, the community is key to everything, and for the NHS to recognise that is a real bonus.
Support from the NHS in helping to establish community gardens, men's sheds, and enabling us to run and provide that support is just so important.
So we started out looking at things that we could do, and what we started out first with was delivering food parcels to people who were social isolating or who were shielding. So we looked around for what we could do and talked to the local allotment society, and they provided us with a pile of food.
We had a few people turn up, a few, and then the following Sunday, just a few more. Then word got round where people got what it was, and sure enough, before long, it was very well used, and it's become a huge part of our community. And we're addressing all sorts of needs. So we are addressing mental health needs, and we're addressing physical needs too.
So we're now supporting something like 60 families each week. There was a lady who came up to us about a week ago who was back in work for the first time in a year, but she's actually got her old job back, in fact a slightly better version of her job, but she's a single mum, and her statement was very simple, that it helped her keep her family together and allowed them to survive the pandemic.
The fact that the NHS can be stuck in at a local level and see the needs and help existing projects, I think is a beautiful thing.
When the pandemic started, a lot of the services, they moved online, or a lot of the support groups that was run locally, they moved online. And so our elderly Nepali people, they were struggling to, let's say, book appointment with the GPs or accessing any of the support system that is available. So it's sort of like
reducing the social isolation, but also it's like digitally making them competent, giving that sort of skills.
Many of these people live in a HMO as well, housing in multiple occupations, and pre-pandemic they used to come out in the park like this and mingle with other people. When they were by themselves in those rooms, they had no phone, they had no television. That obviously really impacted their mental well-being as well.
We have been delivering online sessions via Zoom. We do sessions once in a week.
There is a gap between the community and the service provider, and I think projects like us, projects that are led by people who are in the community, helps to bridge that gap. Because you guys have given us this funding, you guys have really encouraged us to do more in the community, and we are able to connect with lots of young people and other organizations, and that has given us lots of confidence.
We have seen what is the demand and what needs to be done, so when you listen to us, then we get more done, we get to help more people. I think that's the one message.
The idea was that I knew that we had a lot of rich culture in our community, and I wanted to make sure that everybody was aware of it. And by sharing culture, we're then promoting education and encouraging everybody to appreciate all of the rich culture that we have in our community, because there's so much in Bracknell which we still don't know about, and everyone should be open to learning more about them.
So I've just been at an online cultural event this afternoon in Bracknell, where we've had a number of people from our local community talking about their rich experiences of culture, coming from different levels and backgrounds, talking about various things like food recipes, and also some of the engaging projects that they've done for charity in and around the community and also different parts of the world.
This project is to help to improve the local residents' and patients' health well-being, and by demonstrations, cooking techniques, different talks, different informative ideas from the communities to share with all Bracknell Forest residents or patients.
One thing that I would say to local healthcare services is always be open to learning about new cultures, and always be open to developing on the current practices that you have.
We wanted to make sure that we could do everything that we could to make sure that the most vulnerable people within the community were supported. And so with discussions with partners, including the Frimley Health Trust and the local authority, we came up with the idea of looking to see if we could pilot the Wellbeing project.
The Wellbeing Circle project is about building a network around a patient to enable them to be independent, enable them to go out to socialise, which has a positive impact on their health and well-being.
You've got this resident who needs something, and then we find a way to meet that need.
A number of the people that we've supported, for example, have just not had access to the internet, have not had access to computers. And so we've been able to reach out to our network to be able to find people to go in to support individuals to set up laptops, to set up the internet within their house, so that they then suddenly have the ability to be able to access online shopping, for example, and therefore get shopping deliveries.
There's so much opportunity out there that if we don't engage our voluntary care organisations within the integrated care world that already includes health and social care, we are just missing a huge opportunity, both for them, for us, and for, most importantly, for the residents.
It's about sustainability, it is about driving forward, and I can only see it growing.
The partnerships have been absolutely amazing and extremely strong. So we're here at Salt Hill Activity Centre, which has been converted into a vaccination site. And we've developed various different methods of working with our volunteers and our volunteers working with the public.
So I work from home So I wasn't actually getting out to see anybody or getting to go anywhere or having stuff. So I thought it would be a good opportunity to actually get out of the house. But also I wanted to be able to do something for the community.
It's our little roles that are making the big impact in the long run. From everything we've gone through in the last 8 months, it wouldn't have worked smoothly without the youth organisations and the community groups.
The Untitled Champion started around November. Volunteers and residents were allowed to sign up to become a community champion. We hold fortnightly sessions, which gives champions latest information from public health, messaging that is important to get out into the community.
When you work with local organisations that care about their towns, you will always get a good result, and you will always get the buy-in of local people. People who know their own town, know their neighbours, and know exactly the way that we can communicate with each other and work together.
Seeing the work that both individual residents and communities are doing is really absolutely awe-inspiring, and it's what keeps me going.
The one message I would give to communities is you can and you are able, and we are listening, and we can support you, sometimes with funding, to achieve your visions and your ambition. So come on board, work with us, the door's open, and we want to hear what you have to say.